Hello dear students, today we are going to start a further discussion on our already started topic, that is antibiotic. But this particular chapter in your syllabus is divided into chapter number 1 and chapter number 2. So continuation of the study of chapter antibiotics. Today we are going to start the discussion on chapter number 2, lecture number 1, in which we are going to cover a very new class of the antibiotic, that is macrolide class and miscellaneous. Some of the miscellaneous compounds which are not totally actually belongs to any of the type of antibiotic like aminoglycoside, penicillin, beta-lactam, cephalosporin. They are not coming under the category of these basic classes of antibiotics, but they are going to show similar actions as like that of antibiotics. So they are enlisted under the class of miscellaneous class. So myself, Dr. Ketaki Dane, herewith going to explain everything about the remaining two classes of the antibiotic class, that is macrolide type of antibiotic and next is miscellaneous class. So here is a discussion, that is next class of the antibiotic, that is macrolides. Now the group of scientists have not stopped the study of macrolide, study of a penicillin type of antibiotics. The research glamour created by the discovery of penicillin, it is there, continuing its way, resulting into the identification of total new class of the antibiotic, that is macrolide type of antibiotic, which is isolated. This macrolide is particularly isolated from the actinomyces species. This is group of chemically related compound which are distinguished by three common features. This class is particularly distinguished from other classes of the antibiotic due to basic three reasons. What are the reasons why they are totally distinguished from the other classes of the antibiotic? They are: number 1, a many-membered large lactone ring is present in its structure. So macro belongs to large, lights belong to rings. So they have the presence of many-membered large lactone ring in its structure. This is a first basic criteria they are distinguishing from the other classes of the antibiotic. Criteria number 2, various ketonic and hydroxyl functional group. They do have the presence of various ketones and hydroxyl functional group in its structure. And third is presence of glycosidically linked 6-deoxy sugars. So three basic properties and chemical differences present in the class of antibiotic, they are distinguishing them from the other classes of antibiotic. Now what are those three basic properties? Presence of many-membered large lactone ring, and due to the presence of this many-membered large lactone ring, the name is given, that is macrolide, that is macromolecule, a big molecule. Now next is presence of various ketonic and hydroxyl functional group. They possess various ketonic and hydroxyl functional group. And third is presence of glycosidically linked 6-deoxy sugar. So these three important criteria, they are distinguishing them from the other classes of the antibiotic. Now they are obtained from, already we have discussed, they are basically obtained from the Streptomyces species. Now what are the basic examples of the class of macrolide type of antibiotics? There are three in nature, or three examples are there: erythromycin, azithromycin and clarithromycin. Now more oftenly, these macrolide antibiotics in which the lactone ring has either presence of 12, 14 or 16 number of carbon atom in its structure, which are base partially unsaturated with the presence of double bond. So they contain the presence of either 12, 14 or 16 number of carbon atom in which the carbon-carbon double bonds are partially unsaturated and they possess the conjugation with the ketone functional group. At present, there are more than 70 such antibiotics are reported. Kiti macrolide type of antibiotics they are there in the market? Till or presently more than 70 such antibiotics are reported. The presence of dimethylamino group on the sugar moiety, when we discuss the structure, that is the presence of dimethyl group on the sugar moiety imparted, this presence of this dimethyl group on the structure of this sugar moiety will impart the basic property to this macrolide type of antibiotic. These antibiotics are called as, this type of antibiotic, that is macrolide, example erythromycin type of antibiotics are called as penicillin substituents. They are employed to treat the infections due to kutla type चे infections they are going to treat due to penicillin resistant organism or where patient feels allergic towards penicillin analogs. If any patient is going to be having allergic type of reactions with the penicillin, then we can go for the erythromycin or for the macrolide type of antibiotics. They are generally effective. These type of antibiotics are generally effective gram positive as well as gram negative type of microorganism. So they are basically used to treat the infections which are caused by both gram positive as well as gram negative bacterial type of infections. That means they are coming under the category of broad spectrum type of antibiotics. They exhibit their spectrum of activity is broad in nature. They are not influenced by the enzyme, that is penicillinase. In the case of penicillin, the penicillinase enzyme metabolize them into the acidic and basic species. So this is not the case with the macrolide type of antibiotic. Macrolide type of antibiotic are not influenced by the presence of penicillinase type of enzyme. They develop resistance by the other route. Examples of macrolide type of antibiotics we have already discussed. Those are erythromycin, azithromycin and clarithromycin. Now they are the antibiotics used to treat basically the respiratory tract infections such as pharyngitis, sinusitis and bronchitis, genital, gastrointestinal tract and other skin infections. So these type of antibiotics are used to treat the respiratory type of infections. So the first example, that is erythromycin. This erythromycin is an in which there is presence of amino sugar and dizoamine is attached to the C5, while other carbohydrate skeleton, this other carbohydrate skeleton is attached to the clandisone, which is linked to the C3, that is carbon number 3, and the large lactone ring. This large presence of this large lactone ring is known as erythronolide. This presence of this large lactone ring is nominated as erythronolide, and this erythronolide is attached to the two sugar fractions. One is amino sugar and other is normal sugar molecule. Amino sugar is attached to the say 5 carbon atom and the other sugar is attached to the ortho O glycosidic linkage at carbon number 3. The large lactone ring, already we have nominated them as this is known as erythronolide. Now the two structures closely related to the erythromycin, they are isolated from the species they are isolated from the species Streptomyces erythraeus. They are identified. Now we are going to isolate two species, that is Streptomyces erythraeus, from which we are going to identify Streptomyces B and Streptomyces C. The Streptomyces B, that is B analog, does not possess C12 hydroxyl group, which is more stable but less active than the erythromycin E. Erythromycin have two classes, erythromycin A and erythromycin B, out of which erythromycin B is going to have the presence of hydroxyl group at carbon number 12, which is more stable but less active than the erythromycin A. Now erythromycin is active against Neisseria, influenza and Legionella pneumonia type of infections, but not against the Erythrobacteriaceae type of enzyme. Its activity shows the pH dependence. This drug is particularly pH sensitive. This increase with the pH dependence and increases with the pH up to about 8.5. A number of derivatives of erythromycin derivatives are designed to improve either their water solubility or lipid solubility, its acid stability to increase the oral absorption, and so many structural changes done on the structure of erythromycin. Next drug molecule is azithromycin. Now this is also under the class of the macrolide type of antibiotic, that is azithromycin, in which there is also a presence of large lactone ring which is attached to the amino sugar and normal sugar fraction. Azithromycin is active against many more respiratory tract pathogens, includes pneumococci, mycoplasma and chlamydia. So these type of respiratory infections we can treat with the help of the drug azithromycin. To treat the throat infections and non-gonococcal urethritis, it is expensive drug and used to prevent the bacterial complications in the case of AIDS type of diseases. Next drug is clarithromycin from the same class, that is macrolide type of antibiotic. Presence of lactone ring, large lactone ring is there, presence of amino sugar and presence of another sugar moiety. This is used to treat the bacterial infections affecting skin and respiratory tract. This is combined with other drugs to treat the stomach ulcers which are caused by the H. Helicobacter pylori type of infections. Mechanism of action of the macrolide type of antibiotics. How come they are going to be show their bacteriostatic or bactericidal action? Now macrolides inhibit the protein synthesis by binding to the 50S ribosomal subunit. So they are going to stop the synthesis of protein by binding to the 50S ribosomal subunit. Now we all know translation procedures in which there is involvement of the ribosomal subunit is there. Now suppression of RNA dependent protein synthesis by inhibition of translocation of mRNA. Now this particular drug will suppress the RNA dependent protein synthesis by interfering in the process of translocation of mRNA. Now we all know mRNA is the messenger RNA, carries the information, that is which protein is to be synthesized in the step of translation procedure. Now the drugs, the macrolide class, will interfere this process, that is synthesis of protein. They are bactericidal at high concentration against very susceptible microorganisms. So in this way, by interfering in the procedure of the translation procedure of protein synthesis by binding to the 50S ribosomal subunit. They will stop the sequence of the amino acid, or they will disturb the sequence of amino acid and interfering in the procedure of synthesis of protein. Now, some of the side effects of this type of drug: nausea, vomiting, abdominal pain in some cases, chest pain, dyspepsia, that is burning sensation inside the stomach, flatulence, vaginitis, swelling of the vaginal area, nephritis, dizziness, patient may feel dizzy all over the day, headache sometime, then photosensitivity, some rash type of reactions will occur on the body of the patient, and rashes. Now, some miscellaneous classes of antibiotic. So this is the last part of the antibiotic chapter. Some of the miscellaneous antibiotics which are not covered under any class, neither under beta-lactam, aminoglycoside, tetracyclines, or macrolide, or any other classes. These are the classes of antibiotics which are not covered under any class. They are categorized under the class that is miscellaneous type of antibiotics. Now, they shows their bactericidal property but not included under any class of antibiotics. This class of drug shows antibiotic action by chance. By chance means they may have they contain the presence of examples: chloramphenicol, vancomycin, novobiocin, and clindamycin. So the first example under the class of miscellaneous class is chloramphenicol. These antibiotics, that is miscellaneous antibiotic, retain their reputation in the chemotherapy. See, they are not belongs to any class of antibiotic, but they retain their use in the chemotherapy treatment, though do not contain any common structural features with any other type of antibiotic class. Due to their high clinical utility, they deserve the special attention, and such type of drug which is covered under the class of miscellaneous antibiotic is chloramphenicol. Now, this chloramphenicol particularly isolated from the Streptomyces venezuelae species by Elrich. Chloramphenicol is now produced totally nowadays. Now, earlierly it is derived or obtained from the Streptomyces venezuelae species, but nowadays this chloramphenicol is totally synthesized in the lab. It contains chlorine and it is obtained from the actinomyces and thus named as chloromycete. The another name from the chloramphenicol classes, they contain the presence of chlorine and obtained from the actinomyces species and thus named as chloromycete. Chloramphenicol has a spectrum of activity which will resemble that of tetracycline, except that can exhibit a bit less activity against some gram-positive bacteria. Gram-positive bacteria. They are used to treat the typhoid fever, meningitis, Roxy mountain spotted fever, and so on. It possesses marked effective against several gram-negative bacteria, and their ability to penetrate. They have the ability to penetrate the CNS. The ability to penetrate the CNS and alternate therapy for meningitis. So they have ability to penetrate the CNS. That's why they are used for the treatment of meningitis. This is also used to treat the enteric fever. This is alternative drug in the place of cephalosporin and to treat the anaerobic infections and intraocular infections. Next drug is clindamycin. Next class of antibiotic class, they are clindamycins. But this is an example of the class of the antibiotic, that is lincomycins. Clindamycin is a semisynthetic derivative of the antibiotic class, that is lincomycin. Generally, lincomycins have similar topological, antibacterial spectrum, biochemical mechanisms of the action, pattern of the bacterial resistance and cross resistance with pattern of the bacterial resistance and cross resistance with that of the erythromycin analogs. So these type of antibiotics are used to overcome the resistance of the erythromycin. They exert bactericidal actions on gram-positive bacteria. They are going to show their activity against the gram-positive bacteria, particularly Staphylococcus aureus. The activity shows the concentration dependence pattern. Variations of the substitutions at pyrrolidine pattern C5 chain affects the ability. This is a semisynthetic derivative of the lincomycin and rarely used today and reserved for the patient which are allergic totally to the penicillin. They are totally toward the penicillin. The ability of these classes, that is lincomycin, to penetrate into the bone, they have ability to penetrate into the bone and adds to its qualities which get promoted in the chemotherapy. As they are going to penetrate the bone cells, they have their individual application in the chemotherapy of the bone and joint infections by penicillin resistant strain of Staphylococcus aureus. So this is all about the class, that is clindamycin. Mechanism of action is chloramphenicol is going to inhibit the protein synthesis. It prevents the chain elongation by inhibiting the peptidyl transferase enzyme activity of the bactericidal type of infections, bactericidal type of action. It specially binds to the 50S ribosomal subunit and prevent the peptide bond formation, that is joining of the amino acid. Next class is clindamycin. Inhibit a protein synthesis by binding with the again 50S ribosomal subunit of the bacteria. Topical clindamycin reduces free fatty acid and concentrations on the skin and suppress the growth of bacteria found in sebaceous glands and follicles. Now here is the synthesis of chloramphenicol. Now sometime this type of synthesis they are asked for the exams.